This podcast is brought to you by Prolongevity, the award-winning 8-week program that can transform the lives of people with prediabetes, type 2 diabetes, and many other lifestyle-related illnesses. Founded by Graham Phillips, the pharmacist who gave up drugs.
Hello, and welcome to the latest edition of the Prolongevity podcast. Now, anyone who's heard me talk will often hear me say something along the lines of diabetes is a gateway disease. Generally speaking, the diabetes doesn't kill you. But what does kill us are the three major killers, Western diseases, cancer, dementia, and cardiovascular disease. And I have had a really good understanding of the relationship between diabetes and cardiovascular health, heart attacks, strokes, and so on. And I would recommend, if you haven't done so, watch my podcast with Brett Scher, where we discuss the effect of diet and brain function. Now, the way Western medicine works, you'd think the brain was completely isolated from the body. But as Georgia Ede, who I think is a fantastic psychiatrist, said recently, famously, the brain was connected to the body last time I looked. And so I've become really fascinated about how the diet affects mental health. And we know that there's a history of this going back to the early days of epilepsy, where epileptic kids were treated, first of all, with starvation, and then with with the keto diet. So we kind of know in our dim and distant past that there is a relationship between what we eat and how we feel and how our brain behaves. So as I've embarked on this journey, I've increasingly met a group of people in the whole metabolic psychiatry space. And I'm delighted to have with me, it's a bit of a long introduction, Erin Bellamy, who's just completed her PhD and is just setting up in practice. So welcome, Erin. Good to see you again.
Thank you for having me, Graham. It's really, really great to be here.
So Erin, tell us a little bit about your own health journey and how you ended up here, because none of us have come here by direct route, I don't think.
I don't think I've met a single person that has come here by direct route. So you're correct there. Yes, it goes all the way back to 2014, 2015, way back when people were only looking at the ketogenic diet for type 2 diabetes. And I think there was a resurgence of the Atkins diet. I think there was the Atkins for a New You, that book had just come out.
Yep.
So back then, I was following the latest diet, as most people my age did at the time. And I was working in the National Health Service. My background is psychology. And I had just completed my master's in psychiatric research. And I was just gaining some experience on the inpatient psychiatric wards. And every day I would go in and I'd be working on these acute wards where people are really, really unwell. And I was looking at what they were being fed, and I was looking at how they were being treated, and I was looking at what was going on day to day and supporting them, in their recovery. And as I took on the diet for myself, I was noticing changes. So I was noticing weight loss, my skin was clearing up, I was starting to feel a lot better. And my research interest prior to that, during my psychology training, had been on eating disorders. So that had always been my first love. So diets, eating disorders, the interaction between nutrition and mental health, that was always playing on my mind. And I remember one day thinking to myself, I think I might have been on a night shift. I remember thinking to myself, there's this research about the ketogenic diet and type 2 diabetes. I wonder if there's anything on ketogenic diets or low carbohydrate diets or low glycemic diets and mental health. So I went on to Google Scholar and I was going through EBSCOhost and I was looking for these papers, and I came across a paper from 1965. And anybody who's met me recently is probably completely fed up of me sharing this story, but the paper completely changed my life. It was you're probably familiar with it. There's a pilot study on schizophrenia by Pacheco, Easterling, and Pryor. And what they did was they took some inpatient women on an inpatient unit. They provided them with a ketogenic diet. all of the women had a significant improvement in their symptoms of schizophrenia, so their delusions and hallucinations. Then they reintroduced the standard diet and all of their symptoms worsened again. And I thought, oh my goodness, 1965, here we are in 2015, 2016. This is fantastic. Let me see what else there is. This is so interesting. So I went searching, came across one or two papers from 1970 where they were looking at if schizophrenia was rare, if grains were rare, and it seemed to be so. But I didn't find anything else. And I thought that maybe it was because I was tired or I was a poor researcher and I couldn't find the research. I was like, where is it? Like, how can it be this long and there's no research? And at that point, I had decided that, I had seen how the ketogenic diet had benefited me, and I really thought that it could have improvements. It could improve the health, physical and mental health of those that I was working with. And I thought to myself, well, I obviously can't practice this clinically if there's no research, but why is there no research? Where is it? What happened? And so that then started my long quest to reach get my PhD, specifically in ketogenic diets and depression, to really create this research so that we could have an evidence base moving forward, and to see if we could actually be able to treat people with a ketogenic diet for their mental health symptoms. So that was a long version. I apologize, but hopefully it helps to kind of build a bit of a picture.
So most of the people that I've had on are all health professionals, the majority. And they've all had as indeed have I, they've all had their own health journey. And it's partly out of frustration because they couldn't fix their own health as health professionals with all the conventional wisdom that made them look outside the conventional wisdom. Is that true for you?
I do think so, both for me and for the people that I was working with. So for me, I came at it from a weight loss perspective, and I did extremely well initially. Then a couple of things got in the way, but then I did well again, and I've been on the ketogenic diet now since 2014. And so, yes, it was the only thing that actually worked for me. Calorie restriction didn't work very well. Moderation didn't work very well. I'm one of those people that doesn't do well with moderation. For me, it's better for me just to have my food groups, and I feel great eating the way I do. But then also seeing the same characteristics in the people I was working with, and seeing how, unfortunately, how a lot of the support that the patients I was working with had, how it wasn't enough for them, for their metabolic health. We didn't even know what metabolic health was actually back then. It was just their physical health was poor, and so was their mental health. And I thought, well, the research is good for diabetes, maybe it's going to, and so on. And so I think from both standpoints, both from my standpoint, yes, I was frustrated, but then I was ecstatic when I found something that did work and that I found so easy once I got the hang of it, and then thought, well, if I can do it, why has nobody else spoken about it in so long, and why has nobody else shared it as an option? Doesn't have to be the only way, but as an option.
Because Chris Palmer, who has written that fantastic book, Brain Energy, talks eloquently about his own mental health journey and how he really struggled with his mental health. He's a Harvard psychiatrist, so, a big brain in a very, very influential academic clinical institution, and described his own health journey, which was basically he had metabolic syndrome, kind of diabetes type situation. And he had pretty poor mental health, and he had a long history of poor mental health. He'd not been brought up in a very happy home. But he alighted upon the ketogenic diet really to fix his metabolic health. And to surprise and amazement, found his mental health massively improved. And then it was pretty much serendipity. Tried it on a couple of patients, not for their mental health, but for their physical health, and saw incredible results. And I've certainly found this since I'm not necessarily permanently ketogenic, but I'm permanently healthy, real food diet. I'm low carb, and probably keto some of the time. And I haven't just found that I've lost weight. I just feel so much better. My mood is more consistent. My sleep is better. My energy levels are better. So the benefits are physical, if you like, but they're mental. And is that the same experience that you've had?
Yeah, absolutely. Both personally and clinically. Personally, my hunger and cravings for things is non-existent when I am in a state of ketosis. For me, I need to be in a state of ketosis personally. Not everybody does, but I do, because I find that I don't have to think much about food. I can be in control of my food decisions quite easily. I'm not swayed by, ice cream and cookies. It just doesn't bother me. And I can tell very quickly if I have come out of a state of ketosis, because then those types of foods do try and tempt me. So for me, kind of my safe space, I suppose you could say, is in ketosis. And over the years, with a lot of trials and testing and experimentation, I found the range that I like to sit in. And actually, interestingly enough, it does seem to change over the course of the month for me as a female. And it's taken a couple of years to figure that out, but I have, and now I'm in a nice spot where, everything is calm. And that sense of calm that I have has really helped me both, physically, of course, but also got me through my PhD, gets me through the day to day, helps me, I think, make decisions, gives me a little bit longer to make decisions. I'm not reactionary anymore. I never really was, but it definitely helps to give me a little bit of buffer time to make, give the right answers and make the right decisions in my life. And we live in such a busy society and a busy life, and everybody's looking for a reaction and looking for this and looking for that. And I think, what the diet provides me mentally and physically is just something kind of the opposite to that. It's calm, it's zen, and I really enjoy this state of being.
Okay, so we're talking about ketosis. We bandy around the word ketosis. And then people hear the word ketoacidosis. I was talking to a very senior physician the other day, and that person, we hear it a lot in medicine, don't we? Oh, anything that says keto equals ketoacidosis equals this is really dangerous stuff. So when you talk about keto and ketosis and your level of ketosis, what does that mean to you? How would we interpret that? Because I think it's really important people understand what it is that we're talking about in simple language.
Yeah, absolutely. I get the question so often, and there's a lot of confusion around it. And even with health professionals, there's a lot of confusion there as well. So really, when we're thinking about a ketogenic diet, that is purely something that puts you in a state of ketosis. So anything that reduces insulin levels low enough for ketones to be produced, that's how we move into ketosis. And so that can be through a ketogenic diet, through fasting, or through other means. And when we are thinking about ketosis for fat loss, for example, we'd be looking for blood ketone levels of above 0.5 millimole on a blood ketone meter. Now, that's relatively low. That's just over the cusp of nutritional ketosis. Now, the levels of ketones can range all the way up to in the 30s, as you know. And when we're looking at things, or when we come across ketoacidosis, ketones in that range, that's what you're looking at. However, only with type 1 diabetes, poorly managed type 2 diabetes, people who are on insulin, and in one or two cases, people who are on a ketogenic diet but lactating, so breastfeeding. Only in those few cases have there been episodes where you would reach diabetic ketoacidosis and those levels. When we are looking at improving physical health or mental health, or trying to do these things with a ketogenic approach and moving into a state of ketosis, we're much further down the scale, and we're looking at a range of ketones from about 0.8 up to about 1.5 or 2 millimole. Now, that's average. It definitely ranges. Some people feel that they see more improvements in their well-being and their energy and anxiety, for example, a little bit higher. Some people even feel benefits up to 4 millimole or so. And then, in fact, even within some of the epilepsy research, some ketone levels in and around 4 or just above 4 millimole have been shown to reduce the frequency of epileptic seizures. However, when we're looking at physical and mental health, generally speaking, it's much lower. And at the same time, our glucose levels are regulated, our ketone production is within that range and kept within that range with how we're eating and how we're not eating. And it's a very safe place to be. The other thing that people don't know, or maybe very few people know, is that if ketones are increasing up to 4, 5, or 6 millimole, that would usually only occur if you were fasting for a couple of days at a time, maybe 5, 6, 7 days at a time, which not that many people are doing on a regular basis. And even if you were to get your ketone levels up to about 5, 6, 7, maybe 8 millimole, which is where the ketone monitor cuts out, your body actually has a mechanism whereby it will release insulin in order to regulate the ketones. So unless you have type 1 diabetes, poorly managed type 2, or you're breastfeeding, for example, you are very unlikely to move into a higher range. So you have a safety net there. And I think a lot of people don't know that you're not going to get those high ketones because you're not fasting that long. And even if you do, the insulin is released as a protective mechanism. So really, we're way down the scale in and around 1, 2, 3 millimole.
Yeah. And it makes sense, right? Because if you think about your hunter-gatherer who might have gone several days without any food, they don't all die of ketoacidosis on day 5. I mean, that would be mad.
I don't think we'd be here, would we? Probably not.
Evolution is not that stupid, is it? We talk about millimoles, and that's complicated, and I'm not going to try and define that. But just look at it like you can measure temperature in degrees centigrade or in degrees Fahrenheit, and there's various ways to measure the amount of ketones in the blood, of which millimoles are the ones that we mostly use. And I always talk about human beings as basically dual fuel machines, a bit like a hybrid car. And I'm increasingly convinced that the food we're designed to mainly eat, or the fuel that we're mainly designed to burn, is fat and ketones.
Yeah.
And if you look historically at hunter-gatherers, they'd have been in what you call ketosis, higher levels of ketones and lower levels of blood glucose for the vast majority of time. Yeah. But we know that a typical Western sugary diet, where we're eating a very high amount of carbs and we're eating almost ceaselessly, means we're always raising our blood glucose and forcing our body to burn the sugar or store it in some way, because raised sugar levels are toxic. And bear in mind that the entire bloodstream at any one time should only have 1 sugar lump worth of sugar in the entire bloodstream. If you've got 2 sugar lumps in your entire bloodstream, you've got type 2 diabetes. If you've got 3 sugar lumps in your entire bloodstream, you're dead. And we call it homeostasis, the very tight control of all sorts of things in our environment. Our pH, the rate we breathe, our heart rate, our respiratory rate, our blood glucose, our pH, and so on. And so I think we've gone so far from the diet that the biology and evolution designed for us that we're fueling our bodies on the wrong fuel. And a bit like putting petrol in a diesel engine or diesel in a petrol engine, it misfires and it doesn't run very well. And that's kind of where I think we are. So all this mystique about keto diet really is the diet that human beings, in my view, were primarily designed to eat, and we've eaten for 99.9% of our, 2 million years of evolution. Mm-hmm. Would you agree with all of that?
Absolutely. I think people are scared of the diet because of the word keto, because keto doesn't mean anything. It's not low carbohydrate, it's not Mediterranean, it's not vegetarian or even vegan. It's keto, and it's very difficult to relate to. And so I don't think the media has helped either in the way that it has spoken about it or shared, it's a fad diet, this and that. And so people are scared of it, and it's because they don't have access to the right information. Some of the things I like to share with people when they express this concern to me is when babies are born in a state of ketosis. The mother's milk is packed full of high fat, medium chain triglycerides. That baby is a happy keto baby. And it will remain that way until it's weaned off that food. Also, when we go to bed at night, if we're going to bed at 10 p.m. and we're not eating again until, say, it's a Sunday morning, and we're having a lie-in, we're not eating until 10 a.m. the following morning, we've dipped into the fasting state, and we have probably generated some level of ketones. We just don't know about it because we haven't tested our ketones the following morning if we're not following a ketogenic diet or trying to get into ketosis. So we are dipping in and out naturally all of the time, even with the standard Western diet that we're following. However, these days, it's less likely to be often because we are eating every couple of hours, because the glucose is high and then it drops, and that triggers cravings and hunger. And then we feel like we need to eat something again. And also, to back that up, people often say to me, oh, but what research is there on a ketogenic diet? There isn't much. When actually, and I'm not the first to say this, many have said this before me, we know more about the ketogenic diet than we do about any other diet, because this diet has been researched. The safety and efficacy has been researched as far back as the 1920s. And if you think about how ketones are generated and you think about fasting, those fasting studies go back even further than the 1920s. So, you could go back millennia, referring to, hunter and gatherers and so on. Yeah. So really, there's nothing to worry about as long as you're implementing it correctly. But going back, I got a little bit off topic. Going back to what you were saying about the fuel in the tank, it's a great analogy. Yes, we can use glucose for energy. Of course we can. We can use those carbohydrates, use that glucose for energy. However, the theoretical minimum amount of carbohydrates that we need to live is 0. We only use it for fuel. Yes, maybe you could argue, yes, there are nutrients in vegetables and this and that. Yes, there are. However, the essential amino acids, the essential fatty acids, they are found in protein and fat, and that is what we need to live. So we have to start there and fuel our body with those which are essential for life. And then if we have room and we're metabolically healthy, we can consider adding in the carbohydrates if we want to, but only if we want to and we're healthy enough to do so. And right now, not many people are metabolically healthy. So we come back to, let's fuel our body on fat and ketones, use fat and protein for energy, and less so the carbs. So yes, I totally agree with you on that.
And when you say not many people are metabolically healthy, I always revert to this, because we don't really have the data for the UK, but we do know for America that only it's 8% now. It's got worse. Yeah, the latest evidence is only 8% of American adults are metabolically healthy. Mm-hmm. What do I mean by that? Basically, the entire American population either has type 2 diabetes or will have. That's how devastatingly awful it is.
Yeah. And I think
no, carry on.
Sorry, and I think if you have a look at, how we trend in comparison to the United States, I think we are second in the trend of what we are eating in our diet. So if it's 8% in the US, we are not very far behind in the UK. So we should take note, and also note the fact that the dietary guidelines that we have, and this is probably a topic for another day, but the dietary guidelines that we have, they are set out for people who are healthy. And if only 8% of people in the US are metabolically healthy, well, then that only refers to them. Everybody else probably needs a different approach.
Anyone who wants to learn more about the dietary guidelines, I did a podcast with Zoe Harcombe, who's probably the expert. And she would argue, and I would agree, that actually that those guidelines are set out for the health of the big food companies that make their profit from ultra-processed food, and nothing to do with our own health. But we're probably getting too far off track. So, okay. And I'm assuming in your initial education, you weren't taught anything about any theory about diet and mental health. So what was your understanding of what caused poor mental health before you learned a new understanding of it? What were you taught?
Yeah, exactly. So, I did my undergrad was psychology, and then master's was psychiatric research. One was an honors degree, so very much based in the arts, and the next was a science-based degree, because I wanted to learn broadly. And we learned very much the standard biopsychosocial approach. So biological mechanisms, psychological mechanisms, social mechanisms, and how, these together, any issues within these areas can cause or be associated with the onset of a mental health condition. Very much the neurotransmitter model that's been around for a long time, all the usuals, ACEs, so adverse childhood experiences, childhood trauma, lots of psychologically based theories as to why somebody would develop a mental illness. The closest thing was probably health psychology. But even within health psychology, though we maybe touched on the Mediterranean diet, this is a long time ago now, so the research for that wasn't even as supportive as it is now. Nutrition wasn't brought into it, beyond just touching on it here and there. A little bit like within the medical training, it's not really touched on. And so if it wasn't for my deep interest in eating disorders specifically, and doing both of my undergrad and master's thesis on eating disorders, and trying to bring the two together, and finding myself knee-deep in biochemistry books rather than psychology books, I wouldn't have pulled the two together. And I don't think many people do. And when we look at clinical psychologists now, so psychologists who in the UK are practicing with providing support to people with mental health conditions, it's not something that's discussed. It's something that's very rarely discussed. If people want to discuss their nutrition, they see a nutritionist or a dietitian, and most of the time a dietitian that followed the standard dietary guidelines.
Absolutely. And I was still, in community pharmacy, of course, we see 2 million people a day. So we spend a lot of time talking to people about their general health. People ask about their weight and they come and buy some vitamins. I was taught literally nothing about nutrition other than over severe vitamin deficiencies. And I was taught everything about calories. And I was taught everything about, carbs are good for you because there's lower calorie density. And that's what I understood for 25 years. So I had no grounding in the effect of sleep, nutrition, exercise. Along with most health professionals, we're just not taught this stuff. Everything is some kind of misfunction, and then drugs. And as you say, neurotransmitter theory. And of course, that's true. There are the brain is full of transmitters and the body's full of hormones. That's true. And we were taught about mitochondria, but we were taught they were basically the battery of the cell, and we knew all of that stuff. But no one brought this together in the way that I now understand it. So that would seem like a good segue to me. And I'm thinking where we should maybe start with this whole ketogenic diet. And maybe the starting point would be epilepsy.
Mm-hmm.
I don't know whether you've sort of covered that a lot in your research, but we know that before there were anti-epileptic drugs, the way that epilepsy was treated was with starvation.
Mm-hmm.
And then I think it was Johns Hopkins University. Obviously, you can't starving children is not a good thing anyway, broadly speaking, and you certainly can't starve them long term. But they did find that by starving the children, epileptic kids, it stopped their seizures or substantially attenuated it. Mm-hmm. And I think it was research at Johns Hopkins that came up with the idea of a keto diet. And by getting these kids into ketosis, substantially reduced their seizures or indeed stopped them altogether. Do you want to say any more?
Yeah, no, just to follow on from that, you're quite right. It was back in the 1920s, that's where the research was coming through. And these children were seeing improvements also in their mood, in their energy, of course, the reduction in their seizures. In terms of the dietary composition, their ketone levels that they were aiming for were much higher, up around the 4 millimole, like I mentioned earlier. But incredible that with a dietary intervention, they were able to see such a reduction in their seizures. But then what happened? Then there was the introduction, fantastically so, the introduction of insulin and insulin therapy. And then, moving on from that, other therapies became more prominent, and dietary interventions like the ketogenic diet. People decided on behalf of children or on behalf of people that maybe the dietary change was too difficult and therefore should be reserved for a later treatment and not as a first-line treatment. And so drugs and other approaches became the first line. And so now the ketogenic diet is available for treatment-resistant epilepsy in children, and with quite good results as far as I'm aware.
Results, yeah. Yeah.
And so, I think there are a couple of dietitians who could talk to their experience of working with these children, like Beth Dupek-Kanye and Denise Potter. They've done some incredible work with children over the years with ketogenic diets and epilepsy. And I'm sure they would call for it to be, a first-line treatment, or at least give people the option. Again, just give people the option, to use it and to try it and to see if it helps. That's the thing, giving these people agency around their medical decisions and interventions.
And broadly, it isn't even given to people as an option.
Mm-hmm. Exactly.
I kind of think with the introduction of drugs, we just forgot about diet and we assumed that drugs were always the answer. And the education was lost, the research was lost, and it was all forgotten about until more recently. So, yes, I think we've all forgotten about the value of the ketogenic diet as the drugs have come in, which would be all well and good if the drugs were highly effective and devoid of side effects. But it's not the case, is it? We know both and we also know, interestingly, that the anti-epileptic drugs are used as mood stabilizers in mental health. So there are so many cross-links. We know that diet affects epilepsy. We've just discussed that. We know that the drugs used to treat epilepsy are also used in slightly different doses, perhaps off-label, to treat mental health conditions. So there are numerous interlinks that have gone on for many years that almost no clinicians know about.
Yeah, exactly. I mean, if you think back to the paper I mentioned at the start, the one from 1965, I did a little digging to try and to contact the authors to ask them, why didn't you continue this really important research? And though I didn't get answers from them, when you look at the timeline chronologically, antidepressants and antipsychotics came or were introduced in the 1970s, 1972, 1975. And just like I was saying earlier about insulin being introduced in 1921, that onset or the introduction of those medications just took off. And so if you then follow that research all the way up to now, you can see, just like you mentioned, the shared etiology between epilepsy and bipolar. Yes, these medications are being used off-label, as Dr. Christopher Palmer speaks about so often. He talks about using this in practice with people, as do many others. And that has been done for the past 10, 15 years. I've seen it myself within the inpatient units that I used to work in, and with very good effects. And so, though we don't know all of the underlying mechanisms for each mental health disorder, one could argue that yes, there is, a brain energy deficiency. I think we could say, there is energy dysregulation there, which underpins each of those mechanisms that we could point and say that's because of that and that causes that. Underneath it all, there is this energy dysregulation, and that seems to be shared across epilepsy, mental health conditions, some eating disorders even, and other conditions as well. And I think only now, with the help of Dr. Christopher Palmer's book and some other research that's been coming through recently, the puzzle pieces are starting to finally be put together to build this picture of, this metabolic, this global metabolic world we have in front of us, and how everything is actually just a part of a bigger picture.
And I think about metabolic dysfunction, dysregulation in two ways. One is damage the ability to use energy. But I also think about it as nutrient toxicity and nutrient deficit. So an excess of food-like substances with poison that poison our metabolism, combined with a lack. So I always say that we're not plowing the fields or running a marathon every day. We don't need much energy, but we do need nutrition. And I think people mix up energy, which is calories, which is fine for a car, but we need much more than that. So I'm interested in the micronutrients. Are we getting sufficient vitamins, minerals? Are we getting the right fats? Are we getting the right proteins for an optimal healthy diet, as distinct from energy? We always think about malnutrition in really poor countries. Everyone must be thin. But what's interesting is that in most poor, malnourished populations now, they're not thin, they're overweight. It's not about calories.
Yeah, exactly.
Which I think is a neat segue now into your PhD, which I know when we last met, you were waiting for the Viva, and now you've completed your PhD. And you've kindly sent me a couple of slides. So perhaps we'll turn on. We don't want to do too much PowerPoint, but we've just got a few slides that will just guide us a bit. So we've kind of covered this really, but I don't know whether you want to add any more as a background beyond what we've already said.
I think it's just easy for people to kind of make sense of the whole biochemistry realm by looking at this in terms of what is ketosis and how does it work. So I love this image because really simply, you've got the carbohydrates on the left. The carbohydrates are being reduced. So then within the liver, ketones are starting to be produced. They come out and they are transported over to the mitochondria. They go through that cycle all the way out the top as energy. So in its most simple terms, you can see that when those carbohydrates are reduced, the liver produces ketones, which then can go into the mitochondria and then come out as energy. And that's what fuels us to do our day-to-day activities. So I think it's just the beauty of the simplicity of the image for people that maybe get a bit stuck or a bit confused with the idea of ketosis and ketones.
And this comes back to us being a dual fuel machine.
Yeah, okay. Exactly.
So, your study was looking at low carb and keto diets in people with depression.
Yeah, exactly. So I've just put together a couple of these slides just to kind of give a little bit of an idea as to what I was up to, because the research study was not simple and straightforward. I don't think any PhD is. So I was looking at, my main interest was, does the ketogenic diet improve depression and depressive symptoms? And so what I did was I thought, okay, I need to compare to a control group, which is usual in research. I also want to compare to a low carbohydrate diet group as well. So I had 3 different diet groups. Control was just diet as usual, low carb, and keto. Then with the people that I was, or the people that joined the intervention, I split them into healthy people and then those with higher levels of depressive symptoms. And I call them the depressed group. And I used the Patient Health Questionnaire 9, which is just a measure of depressive symptoms that's often used in research to help me determine which group to put people in. And you might ask me, well, why didn't you just put people in who had a diagnosis of depression and put people who didn't have a diagnosis of depression in the healthy group? It's not as simple as that, because some people do have a diagnosis, but may now be non-clinical. They may be feeling much better with their treatment, for example, or perhaps people may actually warrant a diagnosis, but may not have a formal diagnosis. Whereas the Patient Health Questionnaire 9, it actually helps to differentiate. What I did then was put them on their diet for up to 24 weeks, so 6 months in total. And at different time points, I measured different aspects of well-being. So I measured things like anxiety, stress, positive and negative effect. I measured things like mental well-being, self-compassion levels, and a couple of other things, just so that I could fully understand whether or not people were seeing improvements, because it can't just be only depressive symptoms that you look at, because I'm sure you'd agree, well-being is so much more than that.
Absolutely.
Yep. Definitely. So that was my randomized control trial. Then I also put together a what we call a qualitative study, where I was looking more so, or I was interested more so in people's accounts and experiences of the ketogenic diet. So I took 9 people who had completed the ketogenic diet with me. 4 of them were healthy and 5 of them were in that depressive group. And I ran something called a thematic analysis. And what that is just pulling out the themes and the experiences and accounts of these people to develop themes to better understand, what was difficult for them, what got in their way, what went well for them, so that we can better inform our clinical practice in the future. And to date, this research hasn't been done. So though I started this in 2016 and I've only just finished it, this research hasn't been done and published yet elsewhere. So the randomized control trial is the first one, which hopefully will contribute well to the research. And then this thematic analysis is also the first one looking at ketogenic diets and depression. And I think it will really help us to better understand how to approach ketogenic diets when it comes to mental health, to make it easier for people to implement and to stick to, during social situations and, indefinitely if necessary. So this is a little bit of a breakdown as to what the diets looked like. Because if you look at the research, or if you talk to anybody, everybody has an opinion as to what is a ketogenic diet, what is a low carbohydrate diet.
Yeah.
So based on the research, I determined that the low carbohydrate diet would be about 90 to 130 grams of carbohydrates per day. And then protein and fat ad libitum. What that means is that people were allowed to eat as much protein and fat as they liked throughout the day. So there was no calorie restriction here. It was simply carbohydrate restriction, and they could eat as much of the protein and fat as they wanted and keeping the carbohydrates in that range. Then for the ketogenic, based on the research, I capped it at less than 50 grams of carbohydrates per day. And again, protein and fat ad libitum. So if people were hungry, they'd eat more. If they were not hungry that day, they'd eat less. There was no issue there. It was just all about keeping the carbohydrates under that level. Now, the reason it's set to less than 50 grams is that for most people, they need to be under 50 grams of carbohydrates in order to start to produce ketones. And actually, 50 grams is quite liberal. Most would say you would need to be under 20 grams of carbohydrates per day. But just for the purpose of this research, I set it at 50 because, of course, I wanted people to be able to implement it initially, and we could see if they entered ketosis. And then the upper end for low carb was quite a bit higher, because I didn't want there to be any blurring between the two. I didn't want people doing 75, 80, because then which group were they in?
Yeah.
So 90 to 130, and then less than 50 for the ketogenic.
And just to add, there's no scientific specific definition of low carb. A lot of the studies talk about 150 grams or less. And if you look at what most people are eating, they're probably eating like 300 grams a day of carbs. So that's to give some context. And I think in terms of what's ketogenic, I think that's very much N equals 1. So people have different tolerances of carbs, and they enter ketosis at different levels. So you picked 50, you could have picked another figure. 50 seems as good as a figure to pick. Were you able to track them and see whether they were all actually in ketosis, so that you know that it was generating ketones?
Right. Unfortunately, that was one of my main limitations. So because this was back in 2016 and it was self-funded, I managed to get some funding through my university to provide urine ketone strips, the little strips that you wee on in order to see if you're in or out of ketosis. However, what I then learned over time as the research was coming out is that they are not that reliable. They only give you a binary in or out of ketosis. And after a couple of days or weeks on the ketogenic diet, if you're doing it correctly, they're not going to be accurate. And they are wholly based on, how hydrated you are and things like this. So it was not a reliable way for me to measure whether people were in or out of ketosis. This is good for everybody listening as well. If you are thinking of starting a ketogenic diet, just know that they are not a reliable, initially you can see if you're in or out, but you don't know your ketone levels, and it's not a very reliable way of testing or measuring. Yeah. So that is a limitation of mine. I then got some funding to offer some people a Keto Mojo, which is...
I was just about to ask about the Keto Mojo. Yeah. I've got my trusty Keto Mojo by my side.
Fantastic. Mine doesn't leave my side either. I've had mine since they came out. So I was able to get some funding to send out some Keto Mojos to people. But at the time, the way things were going with them launching and so on in Europe, the timings didn't match up. So my study had unfortunately already started, and we were well underway, and it would not have made sense at that point to have sent out the meters. So it's a big limitation, and that it makes us question the groups. Did these people, the people that saw an improvement, were they in ketosis? Were they not? There are a lot of questions to be asked here, which we will get into when we talk about the results now. But all future research needs to have those objective measures, because really and truly, we just don't know otherwise. The research results then. So here from the low carb group, from the randomized control trial, they saw significant improvements in anxiety, stress, negative affect, and that's at 12 weeks. So at 3 months, they saw improvements there. And then they saw improvements in their depressive symptoms at 24 weeks. So at the end of the intervention, at 6 months. So overall, you can see that those on the low carbohydrate diet did see improvement in their psychological well-being overall. With the ketogenic diet, there was no significant improvements there from the randomized control trial. Now, that doesn't mean that people didn't see improvements. It just means that it didn't reach the level for significance in science and in research. So people may have seen improvements, but it didn't reach the threshold. Now, I have a couple of theories about this. I had a very large amount of people start the study, and I had a very large dropout. Yeah. And when I put together a dropout study and I asked people, why did you drop out? What were the reasons? There were a lot of people were talking about, it was difficult to implement and so on, which we will get to. I'm sure we'll discuss that shortly. But the numbers at the end of the intervention were so low that when I came to analyze it, the level of it didn't reach the level of significance. And I think that my theory is, if I was to do this again, or if somebody else was to replicate this study, as long as they had the numbers, I do think that those in the ketogenic group would have reached significance for different aspects of psychological well-being. Because what we see in the research is improvements. What I see clinically with my patients is improvements, both with low carb and with ketogenic. But I think what we can take away from this, which is quite eye-opening, is you don't have to do a low or a ketogenic diet in order to start to see improvements. You may need a ketogenic diet to feel your best or to improve your metabolic health the most, perhaps, but you can see improvements from a low carbohydrate diet. So that's a great place to start.
Yeah.
When we look then at the qualitative study, so the experiences and accounts of the people who followed that ketogenic diet, every single one of them saw improvements in their physical and their psychological well-being, which again gives me comfort, but also backs up the theory that I have that if this was run again with the correct numbers, that we would see significance within the quantitative data.
Were you able to analyze any individuals? So although as a group it didn't work, were there individuals for whom you saw vast improvements who were compliant?
So unfortunately, ethically, I wasn't able to go back and look at those people as individuals, because when I had put my proposal together and as I received consent from people, I explained that all of their results would be analyzed together.
Right.
So though I would like to go back and do that, it's not something I was able to do. However, on the ketogenic qualitative intervention, I was able to look at all of those individuals individually and look at, what went well for them, what didn't. And I think that's the power for any researchers out there. That's the power of carrying out a mixed methods study or a research group of studies, is doing a quantitative study like a randomized control trial, for example, but also doing a qualitative approach so that you can really understand the individual and what went well and what didn't go well for them on that level.
We did a study, you've just reminded me, years ago in the pharmacy. And we looked at all the people taking metformin as a proxy for diabetes, recruited a number of them to study, and simply did a low-carb intervention. And there were two groups. There was a control group with no intervention, and the intervention group was basically time with the pharmacist, just talking about low-carb and diet and stuff like that. And we saw astonishing results. And this is something we did. I mean, I didn't even know about any of this stuff back then. I just knew that, if you eat poorly, you're not going to be very healthy. And we saw massive improvements. And interestingly, we had a husband and wife, both diabetic, both randomized, one of whom was in the intervention group and one of whom who wasn't. And I thought, let's get a halfway house because they'll mix up. One carried on and was just carried on getting more diabetic and weight, where everything got worse. And the other partner improved. Wow. So, you just reminded me, we almost did, it wasn't as advanced as this study, but it was a kind of rough cut of this. And I must have done, we got this published like 15 years ago. So there we are.
Exactly.
More practice research in pharmacy, I guess, is the conclusion.
Definitely. And I think, it says a lot about what we can do in places like this, in pharmacy or even in the GP surgery. I think healthcare professionals are worried about approaching this, especially with the term keto, like I mentioned earlier. But what we're seeing is, just like you've seen and what I've seen, is people are starting to see benefits from simply clearing up their diet. So even if you don't want to go on a ketogenic diet, or you're too scared of it, or you have all these ideas about it, okay, simply removing the ultra-processed foods is a great start. Then reassess. If you're not feeling great but feeling a bit better, then maybe you'd go low carb and get the support doing that, and then gradually move further into a ketogenic state if needed. But I think we're learning that it doesn't have to be only keto. However, the production of ketones and the presence of those ketones, the effects that they have can be absolutely astounding for people's mental health. So there's no denying that. Here are the results of the qualitative ketogenic diet, the experiences and accounts, the analysis that I did. So I broken this up into psychological and physical. Now, there were actually a lot more results here, but these were the main ones. Physically, all of the things that you and I would expect to see. So every single person lost weight. There was a reduction in hunger, in cravings, a reduction in pain medication.
Yeah.
So their pain, their neuropathy reduced, and they were able to eliminate their medication altogether. Improved digestion, sleep quality and quantity, acne, and energy levels.
Yep.
Brilliant. That's what we would expect, that, wouldn't we?
And my partner, as you know, she is a GP, but she's a GP with a special interest in dermatology.
Ah, interesting. So
and
does
she gets all
yeah.
these young people referred to her with acne.
Mm-hmm.
Rather than reaching for her prescription pad and the antibiotics, she asks them what they're eating, and they're all eating basically a bland, carby diet. Gets them to change their diet, and their acne improves and their mood improves. So there we go.
Exactly. That's it. And I think I look at it I look at this as a foundation. If you can clear up the diet and, make sure that you're hitting your micronutrients, like you mentioned, you're getting your fatty acids and your essential amino acids and so on. If you can get all of that right first, that is your foundation. And then if things are still not improving, okay, then look a little elsewhere. Do you need some psychotherapy, or do you need some medication, or do you need some gut support, or whatever else? But there's no point in doing all of those other things if you don't have the groundwork and the foundation set, because you don't know what's going to work and what isn't. And so when we come to the psychological aspects and improvements, these are what completely blew me away. And this is why I'm still as obsessed about this topic as I was when I started, which is rare for somebody who's done a PhD. So their self-esteem improved, motivation, positive outlook in life, their feelings of control around food, but also around the decisions that they make in life and in their relationships, their well-being improved, concentration, confidence, which you would maybe you link to perhaps the change in body composition, but also confidence in work, in relationships, a sense of reward, and most important, an increased meaning or improved meaning in life. And this one blew my mind, because I remember you asked me if you could look at individuals. The same people, I've given myself goosebumps. The same people who said to me that at the start, prior to the start of the ketogenic diet, they had no get up and go. They didn't know their purpose in life. They didn't know what they were doing anymore. They just felt stuck. They were in bed or at home. Nothing was giving them any meaning or purpose. Their kids had got up and gone and everything. Those same people, after the fact, only after the 6 months of the ketogenic diet, all of that had changed. Renewed meaning in life, just a feeling of get up and go. They wanted to pay it forward. They wanted to tell everybody about it. They felt great. They were able to go out and join community groups. They were able to go back to work after being on disability. All of these things that were not picked up in the randomized control trial. They were not picked up in the quantitative data. But these people saying that, their life had they didn't change anything else other than the food that they ate.
Yeah.
And this was their experience in such a short amount of time.
Yeah.
For me, that's completely mind-blowing. Completely mind-blowing.
And it's not mind-blowing to me, because I see it with my patients and clients on a daily basis. Right. Like, they report this stuff.
Now, yeah.
They come to me for weight loss or their blood pressure, and they say it's a transformation in everything. So, I mean, we haven't published any research on this yet. We're working towards it, but it completely accords with my clinical experience.
Mm-hmm. Yeah, exactly. So often people will say to me, okay, but you are practicing clinically and you're helping people with mental health conditions, but does it work for this and does it work for that? I think what we can take away from this discussion is simply clearing up the diet can help. Moving low carb, may help, ketogenic diet may help, right? And there's some good evidence for that coming through now. But here's a list of areas where the research is being done. So I think the most well-known studies are those around bipolar disorder and schizophrenia and schizoaffective disorder. Then we are seeing improvements in anxiety and depression and treatment-resistant depression as well.
Yeah.
Addiction and alcohol, I think this is really interesting because addiction is such a dividing topic, I think, amongst healthcare professionals and those who are clinicians and researchers as to, where does addiction start? But simply showing that, there is a reduction in alcohol dependency, withdrawal is not as bad, purely having the ketones there present is improving or is helping with that is very encouraging for all levels of addiction. And from my research and from my clinical practice, it ties in a little bit with the anorexia nervosa and the binge eating disorder research, is this quieting of the mind. So the presence of ketones, and I'm sure, you've experienced this when you're in a state of ketosis, is this sense of calm and this sense of zen and this sense of stillness that comes where the mind quietens down. And in addiction and in anorexia and binge eating disorders, the voice is very loud for these people. Yeah. The voice is very determined and very negative, and therefore, will lead them to do all sorts of things and feel all sorts of ways. And a lot of the case studies now coming out on anorexia nervosa and binge eating disorder, people are saying that voice has dampened over time. And I think that that's really encouraging I know there's a clinical trial on anorexia being carried out in the University of San Diego at the moment by Dr. Guido Frank. And I can't wait for the results of that, because this quietening of that voice, I think that voice is, everybody has this voice to some extent. And I think more people will be able to benefit from this on a wider scale once this research comes through and more people start to talk about it. Because just having that level of stillness, that level of calm, that little bit of space between when you react to a trigger, being able to make a decision, I think all of this is gonna come through. Is what we see clinically, and I think it will come through with the research as well.
Absolutely.
Mm-hmm.
So if people want to see more, this is your website?
Yes. So this is me. So though I've been practicing clinically for over 6 years now, I took the plunge post PhD and decided that I would set up my own company, my own private company as well, so that I can see people clinically and put together, programs and processes by which I want people to follow based on my research experience and my clinical experience. You can visit ikrt.org. So that's where you'll find me and my practice. And I have a dietitian that I work with as well, who has a huge amount of experience on ketogenic diets. And one thing to take away from that is actually, it's not just the ketogenic diet. A lot of people will come to me and say, I just want to clean up the diet. Can you help me see if we can see some improvements? And so we will do that together. The other thing that I have going on at the moment is the Keto Med Academy, and that in tandem with my dietitian as well, we are focused on education and educating people around ketogenic diets for physical and mental health. So people can check me out there too.
Brilliant. And so perhaps you didn't get everything out of your research that you wanted, but it was very interesting. And I think what the pharmaceutical industry does is if it gets the result of a study it doesn't like, it just doesn't publish it historically. That isn't science. You've been honest enough to publish it in all its glory. And I'm sure in some ways quite disappointed, because we would all like to have seen fantastic results from the keto diet. But I think you've built a foundation. I mean, as you say, back in 2016, when you were starting, the game's moved on a lot. And if you had your time again and a bit more funding, you'd have done it differently. But that's the point of research. Research isn't necessarily about always getting the outcome you want. And if you knew what the outcome was was, you wouldn't do the research, right? That's the point.
That's exactly it. And I think this is how research goes. I was also practicing clinically alongside doing the PhD. And so I was learning from the people I was working with, and I already knew what the limitations of my study was going to be because I was seeing how they were reacting. And you're quite right. I would have loved for this to have been the groundbreaking randomized clinical trial on ketogenic diets and depression. Who wouldn't want that? It hasn't been done yet, and it would be great if that's what this would have been. But no PhD is groundbreaking. If anything, it's just another drop in the ocean. It's something we can learn from. I am going to get it published in whatever journal will take me. It will be open access so that people can see what to do, what works, what doesn't work, what to consider in future research studies too, because that's what's important. And out of the 100 studies that are going to be done on ketogenic diets and mental health, some are going to be terrible and get terrible results. Some are going to be in the middle, and some are going to be very good. And to be honest, I think I'm actually quite proud of myself for doing it self-funded and for persisting at it for so long, because I've learned so much along the way. And if I can share any of this knowledge with healthcare professionals or patients or clients or anybody, that's what I'm here to do. It's not about the publications. It's about, how many people can we help and how many people can we help inform?
So let's bring it up to date now. So PhD's done. What next for Erin? What are you up to now?
Yeah, it's exciting. So of course we've got IKRT that I've launched, and I'm seeing people privately there, and then Keto Med Academy to be training people on introduction to ketogenic therapies, but also just getting people open-minded and curious about, how it can work in practice. So that's what I'm most focused on, because I'm a people person. I never set out to be a researcher. I am a people person, a clinician, but I do like to balance the two. But then research-wise, finishing the PhD, it's opened my eyes to see how much research still needs to be done, how many areas, a lot of biases need to be, blown out of the water, and lots of ideas that are set in stone need to be blown up. So I've got a couple of research groups that I'm working with at the moment. We're looking into eating disorders and some of the theories around restriction and moderation, and looking more closely at that. And then also looking at how we can get clinical psychologists and health coaches involved with ketogenic diets for mental health. So rather than having them be offside and not curious or interested in nutrition because they weren't taught that, and to get them to be involved and be curious and be educated about this alternative way of care that can work in tandem with psychotherapy and other models of psychiatric and psychological care. So really about education, research, and working with some very cool people to do that. And then also my first and foremost, and what will always be my baby, will be the clinical work. So that's where you'll find me. Yeah.
So as we've discussed previously, I'm building a network. We've got a cardiologist that we work to, and if we need expert input from a low-carb cardiologist with an expert opinion, that I don't have that level of expertise. We've got an endocrinologist, and I've been looking to have someone to help us with metabolic psychology and metabolic psychiatry. I think I found my person. So I'm hoping that we'll be able to work together into the future. And it also means that I can broaden my range of what I can offer to people. And pharmacists are very, very good at knowing our known knowns and our known unknowns. We're good at that. And we don't go outside our area of expertise. So it means I'm much more confident now of taking people on. I'm not going to be treating schizophrenia anytime soon. I wouldn't go near it. But if I got somebody who's got mental health issues and they need some help, I can give them the general help, but I want to bring in expertise and safety net them and make sure, they say first, do no harm. I don't want to take the do no harm to the point where we're so worried about doing some harm, we don't do any good. So I want to build a network around me that I can avoid doing harm, but I can do some good. So final thoughts from you, Erin.
Yeah.
What does a day in your diet look like? What, we've talked about keto. Just talk us through what a typical day would look like food-wise from you, because I think people hear keto, they look at 50 grams, it's all very hard. When someone says, no, forget all that, just this is what I eat, it just makes it that bit easier for them to understand what it looks like in practical terms.
Yeah, absolutely. And I can say that, I've been doing this a long time, so we've been through all different variations.
Yeah.
I actually feel better with very few carbohydrates. So I'm more of an animal-based ketogenic carnivore. And I know it's another term that might be a bit scary, but more of an animal-based approach. I used to fast a lot and I used to eat much later in the day. But actually what I find works well for me now is eating earlier in and around 10 in the morning and then eating again around 2. And because I've been doing my PhD up until now and working full time, and I've been mostly desk-based other than walking and going to the gym, 2 meals a day has suited me just fine. And so in the morning time, usually just have some scrambled eggs, some bacon, maybe a little bit of avocado if I feel inclined. And then later on, it's probably a mix of, I like ground beef, I like pork, sometimes chicken wings, maybe with a little bit of like some frozen veg thrown in there, some olive oil mixed in. Really, really quite simple. And I like to just make sure that, I do keep track of my my micronutrients as much as I can, and I will vary it if I think that maybe I'm a little bit low here or a little bit low there. But generally speaking, the foods that I'm sticking to are quite micronutrient dense and really quite simple. And I think I'm glad you asked this question, because people often think that, keto or low carb is expensive. It's for me, I don't find it is at all, because I'm not eating that much. I'm not snacking. I'm just having those 2 meals, eggs and bacon, and then some ground beef and some veggies in the afternoon. And it's really quite simple and straightforward for me. So yeah, that's what I'm up to.
Brilliant. Listen, I think that's been great. We've done a really good tour of the history of the keto diet from epilepsy up to the modern day and all the research. And we'll link to the various things that you've talked to in the show notes afterwards. Is there anything important that you feel I've missed that you want to just round up with, or do you feel that we've covered everything properly?
I think we've covered everything, but I would leave on this final note, which is there is a lot of positive research coming out, of course, about the ketogenic diet and its effects on mental health. And these incredible stories of people seeing vast improvements within a couple of days. Phenomenal.
Yeah.
What people fail to understand or find it difficult to comprehend is why they don't see those results when they move on to a ketogenic diet as well. And I have to do a lot of setting expectations when I start to work with people. The ketogenic diet is not a magic cure for everything. And you may see improvements straight away, but it may take time. It can take at least 12 weeks just to level you out. So if anybody is starting this, I would say just hold on.
Yeah.
You're going to see improvements, or at least give it the chance to see improvements. You've got to give it a couple of months before you can expect realistically to see those changes. And if it happens overnight, fantastic. But if it doesn't mean that it won't. Just keep going, work with somebody who knows what they're doing so that you can really optimize to see if you can get those results.
Fantastic. I think that's a great note to end on. Lovely to see you again.
Yeah, absolutely. Thank you so much.
Yeah, no, it's been a joy. Very much looking forward to working with you in partnership in the future, and wish you every success with with what you're achieving. I think you're in at the start of something big. So I'm coming to the end of my career. You're at the start of yours, and I think you're in at exactly the right time. So yeah, all power to your elbow.
Thank you so much. It's been absolutely fantastic talking to you and sharing what I've been up to. And yeah, I just can't wait to help to push this forward, even just the smallest amount. We just need to be able to help as many people as we can. So yeah, thank you so much. And I look forward to catching up again with you soon.
Okay, see you soon.
Bye.
If you enjoyed the podcast and want to find out more, join our Wellness and Prolongevity Facebook group. Don't forget to subscribe and follow so you never miss an episode, and maybe share to friends and family who might benefit. Finally, if you think you might need help with diabetes, heart disease, or any of the other diseases we discuss, then book a free consultation with Graham. There's absolutely no charge for this, and we would never put you under any pressure. What do you have to lose? Bye for now, and see you for the next episode.